Yes, hi. This is Dr. Khan, Executive Plastic Surgery, Bloomfield Hills, Michigan. So another very interesting case. This is a nice lady, 41 years of age, 41. She got her implants in 2010, the one and only silicone, what is below the muscle, 534, 528. So as you can see, look at the way this implant is. It's more oval. And as you will see, as I press it, it feels different, looks different, done and block. I removed a small, very small piece of skin at the bottom to help with the contouring. But as you will see, this is like an oval shape. The other thing I want to point out here, this was a very difficult part of the case. You can see the cartilage part of the rib, again, rib and rib. This was very tricky, all done and blocked, the gold standard. There is no spillage. Now, just the way it feels and the way it's spread out, it's kind of very relaxed. It's not more circular. This is just a 15-year-old set of implants, and it is indeed, I'm suspecting rupture. There was a lot of inflammation. This was a very tricky case, and so let's see what it shows. And as you will see, I just want to go ahead and take this ruler, and I'll show you. This is how thin the capsule is. No matter how thin the capsule, the entire capsule has to be removed. And as you can see, look at this, lo and behold, it is indeed very much ruptured. And so just, this is supposed to be the nicer, better, safer gummy bear implant. And as you will see, it is not gummy at all. And it is literally disintegrated. So I'm going to go ahead and let's move this out of the way here. So you can see there's nothing gummy about this implant, and as you will see right here, this is how thin. You can see my glove underneath, and very transparent, thin, nothing out of the ordinary. But as you will see, this is very similar. It's a very interesting day in a sense. I took care of a patient earlier today. The Facebook Live from earlier today was a patient with implants from 1982. And that implant disintegrated pretty much like the same nicer, better, safer one in 2010, the gummy bear, where you can drive an F-150 over it. Look, this is not a safe implant. Do you want this to be in the body? And I will tell you, this is where they are not lifetime devices. And if I look over here, I can make out, this is your $457. $457, what is McGann implant? 457. 457 McGann, completely disintegrated, and a capsular tissue that's relatively super thin. So I'm going to remove my top sterile glove, and I have another glove underneath. Now, as I was doing the left side, which was also extremely challenging, as you will see, done essentially completely right. This is how the implant was sitting, and it was sitting on the ribs. As I was dissecting this off of the rib, there was what is an inevitable break in that capsular tissue. So as soon as that happened, I took the sponge, and as you can see, it sticks to it. It sticks to the area that's open. So I was able to, and let me show you. This is the cartilage part of the rib, and over here. So there was this small break in this capsule here as I was dissecting it off the rib, and it was plugged very effectively, efficiently, such that none of this spilled into the chest, and it was all contained. So as you will see, I'm just going to go ahead and open. This is, again, the cartilage part of the rib. You can see the cartilage part of the rib right here, rib, and then another. And so as I go in and I cut through, you will see this is also very interestingly ruptured. And what were the odds of that happening? This is why they say you need to have surveillance. And this is a very nice patient in the medical field, and completely, what I would say, this is 100% total capsulectomy, completely disintegrated. I want the person to drive the F-150 over this. So as you can see right here, I'm going to flip this around. None of this spilled into the chest, as you can see, because it was appropriately plugged. 457 Allergan is what I'm seeing over here. 457 Allergan. And so I see it right here, Allergan, 457. So look at the way this is disintegrated. Look at the shell. They have studied this. It is a different make, the shell of this implant, and you can see it's literally molten. And the implant from 1982, the left one from this morning, was much more, the implant from this morning, 1982, was much more contained and preserved than this 2010 implant. And so it goes to show you that these implants absolutely, certainly disintegrate, as you can see right here. I did not know on her exam that this was going to be the case. She did not get an MRI, so this was a pure coincidence, pure, I used the word, I did not know that this was going to be both ruptured right and left, and that's why it took longer, and no matter what length of time. So the take-home message here is gummy bear, it is not. With the passage of time, it disintegrates just like the older implants did. This technology is not any safer than what the older technology was, as you can see right here. Not my words, but you can see with your own eyes. The implants need to be monitored. They're not lifetime devices. If you look at Mentor, they tell you to get a MRI year 3, and then every 2 years they're onward. If you look at the FDA recommendations, they want you to get at least an ultrasound, and if the ultrasound shows anything suspicious, then an MRI is recommended, and routine follow-up every 2 years thereafter to basically prevent any of this. Now, you don't want to see a rupture and then pull them out. You don't want this to happen at all, so you don't want to have this leach into the periphery and into the lymph nodes. This is a young lady, 41 years of age, and she decided and opted to get them removed and not replaced. So that was very smart of her, because she doesn't want to deal with this when she's 51 plus minus. So as always, the implants will be returned to the patient, capsules to be sent to pathology, rule out the BIALCL, CD30 analysis, rule out lymphoma, rule out malignancy, rule out any abnormal pathology, cultures for aerobic, anaerobic, and fungal, twilight deep sedation. She's going to see this Facebook Live, and certainly more importantly and most importantly, the videos of the chest wall showing complete removal of the implant capsule directly on top of the rib underneath the muscle, which was indeed a very challenging part of the case. The twilight deep sedation, and she got the same surgery that my other 74-year-old patient from earlier today got. There is no compromise in the care that the patients get. They're all optimized and ready to proceed with surgery and the explant that I did. 20 years from now, I cannot imagine anyone else doing the surgery any differently with the comprehensive, complete workup, so that we'll get feedback from pathology, microbiology. And also, many patients say what is the true purpose of the word en bloc or 100% total capsulectomy. As you can see, once again, none of this spilled into the chest. None of this needed a washout. I will tell you, once this spills into the chest, no matter how much of a washout, you're not going to be able to clean this silicone. And do it right, do it once. Assume always that the implants are ruptured to proven otherwise. So this doesn't happen to the surgeon as they're dissecting on the chest. And so even though it's not a en bloc, it's 100% total capsulectomy, and that silicone was prevented from basically spilling by that sponge, because the hardest part of the case was done at the tail end. The other thing I want to mention here is this can only be done, in my eyes, in my practice, safely by a transverse, i.e. horizontal incision, parallel to the rib. Any of these up and down cuts will not allow, at least in my eyes, from my experience, to do a safe dissection right on top of the rib, where the capsular spread is extensive all the way up, without cutting into the breast tissue, the nipple areola complex, and to be always below. The breast tissue above the muscle was not touched by me at all. And I'm very happy and content with the minimal blood loss, which was less than 5 cc's. Each side total 10 cc's, and this is true in well over 99.5% of the patients. There you have it. This is Dr. Khan, Executive Plastic Surgery.